Hello. So obviously things are changing fast and furious. I heard that the governor has issued the mask mandate again for kids in grades K through 12. All of this is related to the spread of the Delta variant and how quickly we're seeing it show up over and over again in the new cases. And the new cases indeed are rising. The good news, as we talked about last week, was there are now 10.5 million doses that have been given. It's about 5.3 million people. But we just can't get ahead of this virus. It's just that simple. And so if you haven't been vaccinated yet, I just want you to see the hours that we're open. Indeed, we continue our outreach efforts. Really, it's just so important for those people who are on the fence to really seek out your physician, to have those conversations, and whatever we can do to convince you to get vaccinated, I'm urging us to do it. The graphs that the Department of Health provides us, that we then drive our own predictive models, show us that we are going to be back into a surge sooner than later. If everybody had been vaccinated the last time in the spring when this happened, we would not be thinking about how to steady our staff to go back into battle. And that is what this is for us, because the truth of the matter is that this is no longer just COVID patients. People delayed care for a year, and what we're seeing in our hospitals is, even though we've had a fewer number of COVID patients over the last 2 months, we're seeing an increasing number of individuals who are sick with other things. It looks like our flu season is going to start early. And obviously, we're all anxiously awaiting the flu vaccine. But that, with COVID, puts us back at record level of census. And while you've been watching the stories through the rest of the country, the only way we avoid that from happening here is for people to get vaccinated. It's just that simple. So from vaccines to a program that is celebrating a birthday today. This actually is the 10th anniversary of our LIFE program. LIFE is a program that has been created by the federal government to try and provide opportunities for those people who would otherwise be in nursing homes or some type of congregate housing to be able to live at home with a full range of services around them. The LIFE program, obviously, like the rest of us, had to pivot during COVID, but I am proud to say that over the 10 years, we've provided services to almost 800 people, and we are really looking forward to the future as we're getting ready to launch our new center in Williamstown in the fall of this year. So stay tuned for that. So today I want to tell you this great story about using one of our HRO tools to validate and verify. This is when you have a question and you're seeing something and you're not really sure, or you need to ask again. And sure enough, Burgundy Wilson used that tool this week when she was talking to one of our patients. He came in to register, and he was here to see his thoracic surgeon, Dr. Shea, and she just didn't think that things looked quite right. It looked a little gray. He was worried, and she asked him, "Are you feeling okay? Do we need something?" And while he told her no, everything was fine, she did that extra step of actually getting a pulse ox and seeing that his oxygen levels were not where they needed to be. And she went to Dr. Shea, and sure enough, Dr. Shea came right out and saw that something was terribly wrong. They were actually able to quickly move him from one side of the hospital to the other to get him to our ER, and sure enough, the gentleman in question needed a procedure to be able to get back to the right level in his heart to be able to work correctly. This was all happened, which avoided a crisis, because she used the tools, because she took that extra step, and because we have an amazing team of people at Inspira that makes sure that even though you may be entering for one service, we're going to make sure that we're always paying attention to you, your needs, how you present, and we're going to ask those questions to make sure that we take care of you before we end up in a crisis. So I'm thrilled to tell you that he's doing well and thriving, and I'm even more proud to tell you that it's such an honor to be part of the Inspira family with people like Burgundy Wilson and Dr. Shea. So until we meet again, be well and stay safe.